Good afternoon. Thank you for tuning in today to our webinar about 8 critical privacy mistakes too many clinics are making these days. My name is Jeff McKay. With me today is Jen Kreiner, our privacy lead and advisor here at Brightsquid. So today, hi Jen.
Hi.
Thanks for joining us today. I almost rolled right through that without giving you a chance to say hi.
All good.
So today we're going to talk about a number of things. The first thing we want to talk about is cyber threats, because it really does factor into why a lot of these mistakes we're going to talk to you are so critical. We're going to review the top 8 mistakes. We're going to talk quickly about how to prevent them, and that'll come up throughout. And then we'll have winners of the draw at the end and a couple other sort of pieces of advice as we get out. Before we dive in, I will say we will address any questions at the end. So there is a questions panel in your GoToWebinar control panel. You just click in there, type any questions. We'll get to them as we can. If we don't have time, we'll just get to you directly with an answer. So let's look at cyber threats. So a big change in the last couple of years. There are a lot of attacks facing healthcare. So healthcare is actually the #1 industry targeted by ransomware and phishing attacks because of the value of patient data. So patient data is worth up to about $150 on the black market, depending on where and how complete it is. And the real driver for that is because patient data is enough to assume someone's identity a lot of times. So now I can, lease a boat or get a loan and all that stuff, and that person is on the hook for that. And it can be very damaging to credit. All kinds of reputational damage. There's actually a long list of reasons why patient information should be protected because of the different risks associated with that. And with the rise of COVID, we've actually seen a 4,000% increase in ransomware emails during COVID-19. There's a report I was reading this morning that said globally about 51% of businesses are being impacted by ransomware, being attacked. And a shocking percentage of those, about 3/4 of those, the data is being encrypted, so the attacks are successful. The big risk that ransomware poses these days is it's not just what traditionally has happened is that ransomware has locked up data and made it inaccessible, which is a problem for a healthcare clinic. It's difficult to do your job if you can't access your patient data or see who's coming in this afternoon. But it's been pay us as ransom and we'll release your data. Now a lot of the threats that are coming, and there's instances of this that have happened in the United States recently. I think there's 5 large organizations that suffered this. What the hackers are doing is they're not just encrypting the data and holding it away from you. They're actually, the threat is pay me or I will release this data. So they're actually threatening an actual breach. As I said, this happened recently across the US in a big attack. The other big risk that ransomware poses is because it limits your ability to provide care. There's been a number of lawsuits about that. And actually, tragically, last week in Germany is the first recorded patient death associated with the repercussions of a ransomware attack. So it's a serious thing to consider in your clinic. And we'll talk about how that fits into these privacy mistakes as we go through. So let's get into these. So Jen, how are clinics overly helpful? I mean, I know typically people who work in healthcare are there to help, and so how does this mistake factor into a clinic, and what happens?
I think a lot of the times it kind of comes down to customer service, right? Everybody wants to have the best customer service, so they'll maybe go into more detail than they should. Like if I went in and said, "Oh, hey, when's my husband's appointment?" Okay, unless they know that my husband and I are together or that my husband gave me permission to ask, they shouldn't be asking questions or answering questions like that. Again, insurance companies, people can ask an insurance company, or an insurance company can ask a clinic and say, "Hey, could you please send me so-and-so's file?" Well, they need to be more specific than that. They need certain times and dates and exactly what they're looking for. You can't just send over someone's entire medical history unless it's warranted. Parents and guardians, the mature minors, police can't come in, flash their badge and get whatever they want. They need to have a subpoena or a court order. So I think a lot of times people are like, "Oh, how can I help you? What can I do for you?" Where they need to be asking bigger questions and, figuring out what should be done. Yeah.
Yeah, and we get the question about law enforcement a lot in training when we do live training sessions. Even other things like, what about patients that have died, all that kind of stuff. You have to be aware of how much information you're providing. Great example of the spouse thing, there's lots of cases, people are going through a separation or a divorce, and your clinic might not know of that state. And one side of that equation might just call to get information, and people have been served documents at appointments and all kind of stuff that has resulted in problems for the clinic. I remember being at one clinic right after we did a training the next day, actually, and they said, we've already used our training. A woman came in and said, hey, I'm here to pick up my husband. I just want to make sure I have the right place. Can you tell me if John Smith is here? And the front desk staff, having just been trained, said, I don't know. And went back and asked John Smith. They said, yeah, there's a woman here asking for you. Is it okay if I tell her that you're here? And he said, yes, please do. But that was actually absolutely the right step. And I think, maybe before the training, she might have been happy to help, which
Exactly.
could have potentially been a problem.
It could have been if she was a stalker,
Yeah. Number two here, non-secure transmission. So are you transmitting things safely? A big problem in healthcare is email. People just kind of use it as default. A lot of people use text messaging. These are not secure. Jen, what sort of problems do we see where clinics might have a false sense of security about what they're sending or how they're sending it?
Yeah, and I think it's a force of habit, right? Email is so easy to use. I mean, having to take an extra step, a lot of people are like, I don't have time for this. I think just making sure that when you're, for example, faxing something, which again is not a secure method, but doing double checks and that sort of thing. If you're sending emails that has patient information, make sure that it's encrypted. I mean, it's actually, in Alberta, the Health Information Act says that you do need to transport patient information securely. Little half measures like encrypted email. I was talking to a vendor and I said, hey, your clinic thinks that emails are encrypted. And he said, well, actually only the attachment's encrypted. Anything in the body of the email is not. So that is kind of a misinformation because the clinic felt like they were sending out encrypted emails. So just keeping up to date with or asking the right questions is a good one too. And then new technology, a lot of people are like, oh, it's too hard to use. I don't want to do that. I don't like change. Nobody likes change. Nobody.
Yeah. And I think, in that sense, looking back to email, a lot of times patients might say, like, we see it when clinics are introducing secure mail and inviting patients on, and patients say, oh, can you please just send it to my email? Now, patients do not have the authority to absolve you of your responsibility to protect their information. So a patient saying, oh, just email me, I'm not concerned about my privacy, does not mean that you are able to break the law and send things insecurely. If we're talking about HIPAA in the United States, you actually have to provide a secure option. If a patient is insistent that they only want to use email, you can, if you have already provided them and have available a secure means of transmission. So there's lots of rules to be aware of and some nuance depending on your jurisdiction. I will point out quickly before we move on that from a technology standpoint, like you said, GenFax is not compliant. There's 5 or 18 steps you have to take when you send a fax to make sure that's compliant, including calling to find out if their number is still their fax number. So along that line, sending files to the incorrect recipient. So there's one, right? Misdirecting a fax. It happens all the time. There's lots of news stories. You can find them about clinics or non-clinics receiving patient information because it was sent to the wrong fax number. What happens with fax numbers is if someone changes the fax number, they change providers, they change how they receive faxes, those numbers just get recycled into the queue. And if it's no longer associated with the clinic, it might now be someone's home office. It might now be a spa, which happened in Nova Scotia and Halifax for a number of years. A spa was receiving mental health records for patients from this clinic, and they notified them repeatedly, but they kept hitting that speed dial button and they have programs. What are some other ways that this comes up in clinics, Jen?
So a big one is autofilled emails, and everybody knows we all do it. Okay, I'm always like, oh, if I type in 2 letters, will I get the right person? Everybody does it, but you shouldn't. And if you're gonna do it, double, triple, quadruple check, make sure you're sending it to the right person. Another thing, I did have a breach in the last month here that a clinic actually was attaching someone's filled out patient information and sending it to new patients, thinking it was a blank document. So, periodically having those checks in place where you're checking file folders and making sure that the information that's in there is still the information you're meaning to send. So just kind of double checking your attachments, double checking what you've put in the body of your email, double checking what email address you're sending to. And this clinic that had this breach, thankfully was using our secure mail. And I'm not using this as a plug, I promise, but they were able to recall all of those messages. And only 3 people actually saw the actual attachment of the patient's information. So, I mean, this breach could have been so much bigger and so much worse, but they had that option, which I was very grateful for. And then making sure that, go ahead, sorry, Jeff.
No, I was just going to say, and that's part of having the right processes in place, right? And some of that has to do with technology and capabilities and what you can do with your processes, because not all services are going to give you that capability to check and see, 1, was it read? And 2, can I pull it back? And even, simple processes like before you click send on an email, we confirm the email address, or a secure mail message or whatever it is that you're sending out. Let's just take 3 seconds to confirm before we click send. It's little processes like that can go a long way to preventing breaches.
For sure.
So healthcare clinics are busy, notoriously busy, and busier and busier. How does this impact privacy at a clinic?
I think, again, everybody is just go, go, go. Like, if things are getting fired at you a million miles, I think just making sure that you have, kind of processes and steps in place. If you can eliminate some of your paperwork, for example, by using electronic, medical, dental, some sort of electronic record, I mean, you are reducing the amount of paper you have to scan, file, et cetera, et cetera. So those are some processes. Sending emails to people. You can send a secure mail to someone and not reduce your phone traffic, et cetera, et cetera. So, and then making sure all of your employees are trained. People should train their staff. If you want people to do what needs to be done, you need to train them to do so.
Yeah, and things like, stuffing envelopes, you don't need to do that. You can attach it to a secure mail message. We've seen clinics that have reduced phone traffic by 30%. So, and that's actually, they've attributed that fact directly to the fact that they've had an increase in staff retention. So because things are less busy, the phone's not ringing off the hook, we schedule the time that we're going to check our secure inbox. Then, there's less busy work, there's less interruption, and people are able to focus on their job. Next one, over collection of data. So this is a good one, Jen.
Yeah, so this kind of is also the being friendly and that sort of thing. Sometimes people will be nosy, I guess is a good word, be like, oh, what are you here for today? Well, if that's not required for the receptionist to know or anybody in the waiting room, then don't ask them. If that's something that should be between the doctor and the patient, don't ask them. Do not ask for their social insurance number unless you're planning on hiring them, or their social security number. Those are things that are not needed. Just understanding that, a nurse or a doctor or a, receptionist, they all have different roles in the clinic and they all need different information. So just making sure that you're only collecting the information you need to do your job. And that's it.
That's one of the critical privacy principles that we run into a lot. It's just make sure you're not going, and it's a liability. If you have extra information lying around, it's just more risk.
Exactly.
Okay, so inconsistent business processes. What do we mean here, Jen?
So a lot of clinics, when we do our privacy training in person, we would ask people, we'd be like, hey, who all knows who their privacy officer is? I can tell you that more than half the room didn't know. So, that's a really big one. Go ahead.
Yeah, no, I was just going to say, I've been at events where I've been talking to clinics and they've had arguments over who the privacy officer is. It's you. No, I think it's me. No, I think we had that meeting and someone said it's me now, right? And it's stuff that you need to know because you need to have that person who's responsible. But also, from a process standpoint, it's, setting your process once, and we'll talk about this, at number 8, but things are going to change and adapt. And, sometimes consistency is bad, because you're doing things that worked 2 years ago, but software and processes or something has changed that you're actually no longer doing things properly. So there's a couple of things, and COVID-19 reopening is a great example. All of the changes that you've made to your clinic for reopening have impact on your privacy compliance, collecting additional data from patients, from staff, the implications of that data. Someone comes in to fix your air conditioning and you record their name and phone number. What are you going to do with that? How long are you going to keep it? When are you going to destroy it? All that kind of stuff that needs to be, every time you're collecting data, it needs to fall under your privacy policies.
Yeah, and I know like it definitely can get complicated. Like there's certain things that you don't think about. I had a clinic who actually had people sign a sheet that was posted at their door with their names and phone numbers, which is a privacy breach because you can't just advertise that information, right? So just kind of even having that privacy in the back of your mind at all times is super important.
Yep, and I would suggest that anytime, just get it in your head that anytime you make a change at your clinic, like it says here, hey, we've changed our COVID policies. A lot of times we're telling patients as they come in, and that's great. How complete is that? How much you're informed? What are you going to do with that information? But anytime you make a change, there should be a light in your head that goes off, says, how does this impact my privacy policies or my compliance, and what am I doing to manage that? Every time you do something like that, especially software, structural changes, any vendor changes, how do I have to implement new changes in my privacy compliance? Number 7, so inadequate training. This probably could be number 1 through 8 almost. Cybersecurity training is huge now. A lot of stuff is happening online with COVID-19. A lot of us started having digital connections. A big threat here is that all our patients now, a lot of them are working from home. And that number, that 4,000% increase in ransomware attacks was directly associated with that. Attackers recognized that people were working from home for the first time. They weren't trained on how to recognize things. They were outside of a secure environment and they were vulnerable. And if you're connected to your patients via regular email, a lot of these attacks are just going in, finding their contact list and blasting out an email that appears to be from them. So it looks kind of safe because I'm familiar with that person, but it's absolutely not. And so a lot of social engineering on part of these hackers goes into recognizing these opportunities and exploiting them. So we need to be aware of them. And you're not going to have the chance to train all your patients. So it's best to create those gaps and have those secure processes in place. Like we have clinics that do not accept email. When people send them regular email, they say, nope, use our secure mail service. And we've invited you to that for that reason. But Jen, how does privacy compliance factor into this, and why should that be an ongoing thing?
Well, I think with the privacy compliance training, I mean, you can train your staff things like even with the cybersecurity aspect, you can tell people what to look for in an email. I can't tell you how many emails I get a day that are phishing emails. And it just kind of like shows you, and there are some that are really, really good that maybe only have like 2 things wrong with them that if I wasn't in this industry, I would probably click on it because I'd be like, oh no, what, my credit card expired? So it's true, but kind of training your staff to say, hey guys, you need to be really diligent. Make sure that you're following, the laws and the policies and procedures that we have in place. Making sure that if you do bring in a new technology, that all your staff knows how to use it, because that's how mistakes happen. Is if you have something new, someone doesn't know how to use it, they enter in 800 phone numbers, and those phone numbers all got sent information they're not supposed to. So again, those are things you got to make sure you're training and keeping up to date on things.
Well, and refreshers are so important, right? As things change, and people sometimes, we all fall back into old habits, or we develop new ones as shortcuts, and so retraining. Hey, this is how we do things, and this is why we do it. A lot of times when we write privacy impact assessments for clinics, there are policies and procedures written into there that make their setup compliant. So some of the software they use might not have all the soft safeguards we need, but we might help introduce a policy or procedure that aligns better with compliance, right?
Exactly, and just remind your people who your privacy officer are.
Yeah. So not keeping compliant. This is a big one because You know, clinics will get set up, they'll do their privacy impact assessment, 5, 8, 10, even 3 years go by, and they're likely by that point, even as early as 2 or 3 years, out of compliance just because of changes that have happened at the practice from, you know, a software, a policy procedure, but even changes to the legislation happen regularly, and you need to be aware of that and keep updated.
Yeah, it's true. And I know a lot of times, like I get this a lot, like a new manager will come in or a new privacy officer and they'll say, okay, what do I need to do? Because the old privacy compliance officer just didn't care, or they got compliant or whatever it is. Complacent. Keeping up with technology and updates and that sort of thing. We have a lot of vendors now that aren't compliant with the HIA because they don't have, you know, the latest software that they need to make sure that they have auditing, logging functionality, that sort of thing. And then hiring professionals. Okay, I tell people this all the time. I would never ever hire someone off the street to fix my minivan. I drive my children in there and I love them most of the time. Hire an IT professional. Why would you hire your best friend's nephew's son? Like, you have personal patient information, and if you hire someone who doesn't know 100% how to do that job, why would you trust them with something that could ruin your reputation, your clinic, you know, bankrupt you? To me, it's, you know, it's not worth it. Just pay the money, hire someone who does their job.
Yeah, it's surprising to me how many times we have to wait to talk to the IT person until school gets out. You know, a great example of this is we were at CDA North a couple of years ago in San Francisco, and you know, we're at our trade show booth and we're talking to this family that went by, and you know, we said, well, you know, email is not compliant, and the son, who was probably 12, said, well, actually it is. So he was the de facto privacy officer and IT manager at their clinic. Now, he had read the first line of the 8 paragraphs in HIPAA that talk about email that said, you can use email, period. And then the next sentence says, if you abide by these things. And so he read the first sentence and said, great, we can use email, and didn't read the rest of it. So you want to work with professionals who know what they're doing. And even within IT, not everybody is well versed in what's compliant. So you need to make sure that you're dealing with people who are. And you
it's
know,
true.
we can help with some, you know, a list. We've got a lot of really great providers that we work with from an IT standpoint.
Yeah, we get a lot of IT people that are like, oh, is this new? And I'm like, no, the Health Information Act has been around forever. You just didn't know about it. You know, so just kind of those things. And privacy impact assessments. Make sure that your clinic or your business has policies and procedures, has risk assessments. These are all part of the law.
Yeah, well, and just great business, right? I mean, we have financial advisors that we work with in the industry, and I will say that about IT providers. You want to work with an IT provider that has a healthcare focus, because it's a unique environment for them. If they're used to setting up accountants, they're not going to understand the healthcare environment. And there's lots of different providers that have at least dedicated wings of their business that focus on healthcare. And yeah, a PIA, it basically, the financial advisor we work with, some of them will ask clinics, hey, do you have a PIA? And if not, your clinic is at risk and your finances are at risk, because you need to understand the risks to your practice from a privacy standpoint, and you need to understand what you're doing to protect that privacy so that you don't end up dealing with a massive breach situation that can potentially, you know, worst case, shut down your clinic. So how do we prevent these mistakes? Training. You know, I don't think we can say that enough. Right? Using secure technology. So know what you're using is secure. With your secure mail account, you know that you're safe sending whatever it is. You know, like Jen said, there was a clinic that was sending, you know, the body of the email. They were writing patient information, and it wasn't secure. They had that false sense of security. But using secure mail, you know that everything you're sending is protected and safe and stored on our secure and audited servers. So that's a good thing to do.
And it was really great that this clinic that had the breach could recall those messages, so they knew that, you know, it was maintained and controlled. Again, having privacy leads and officers, you got to make sure that the person who is in charge of your privacy in your clinic knows what they're doing and that everybody knows who they are.
Yeah. And they should be the person paying attention to compliance changes, regulations, should be assessing how these decisions we're making in the clinic impact what is, their privacy compliance. So there's tons of stuff that privacy needs to do. The challenge is with privacy officers within a clinic, it's typically the clinic manager, sometimes lead custodian, or a front desk staff who's busy with other things. And that's where it's really important to have privacy supports, a team you can call on with questions, because, you don't want to put things on hold for a day or an afternoon to figure out how a change impacts your privacy, or what happens when a patient calls in and say, you breached my privacy, what do you do, right? Work with professionals to help manage your privacy as much as their IT. Data minimization, we talked a lot about that, right? So make sure that you're not storing more information than you need. You're not photocopying driver's licenses when people come in to get their teeth cleaned. You don't need that information, right?
Yeah, and creating the maintaining policies and procedures, we've talked about that. Making sure you have your privacy impact assessment in place, and making sure that you're maintaining them and updating as you bring in new technology and new staff. Breach plan, super important for a breach plan. If you do have a breach, what are you going to do? First of all, you'll call me. Make sure that you talk to your privacy officer. Those sort of things is really important to have in place.
Yeah, with mandatory breach reporting in place now in Alberta, across Canada, and in the US, you need to notify if there is a breach. But the clinics we work with, but like you said, Jen, call us first, because reporting a breach may not necessarily be necessary. And so we can help you identify a breach that is necessary to report and ones that aren't.
Exactly. It all comes down to risk of harm.
Yeah, exactly. And understanding what that means and how to assess that. And then, what do you do if there is? And how do you notify? And who do you notify? And what do you do about moving forward? So that's really important to have. And that's actually law under the Health Information Act, that you have a plan in place. And what do you do if you have a breach? And implement change control. As we talked about, have a process in place. When we change something, we have to assess the privacy, and it may take a minute, it may take an hour to figure that out, but it is absolutely worth that step. Anything else to say in here, Jen?
No, I think we covered it all.
Okay, we're getting close to the end. I just want to say really quickly, there's lots of additional resources that we have available to you. If you haven't taken a privacy risk assessment through our website, 7 quick questions that help you understand. We'll give you, where your clinic may be at risk. We'll give you a score. We can work with you to help get it higher if it's too low. If you have done a privacy impact assessment in the last couple of years, you're probably good. But if you haven't done it for about 2.5, 3 years or more, you should definitely look at revisiting that. And we can help you do your privacy impact assessment. Just go to the website, click on privacy consulting, and you can get you to there. We have virtual care webinars, how to conduct virtual care safely. Secure mail training is an important step to take too. And also listen to our podcast. We have privacy webinars, and we have privacy podcasts available. If you just hover over privacy consulting, you can click in there and access a lot of resources about privacy compliance. Winners of the draw today. So for most secure messages sent in the last 30 days, on the call today is Carrie M. So congratulations. Thanks for being diligent with that and keeping your practice safe. Most secure mail invites. So with a full secure mail account, you can invite any other practice and any of your patients to have their own free account that you can use to communicate with them. Heather L is the winner for most invites. So congratulations on that. And for showing up today and listening and learning about this, Lisa B wins. So congratulations. I'll just end by saying, let's keep your practice protected. We work with hundreds of clinics for ongoing privacy support. Ongoing training. You'll have access to privacy training for Alberta through your secure mail account. I do recommend accessing the training for secure mail as well, because it does help clinics really understand how to implement it fully in their clinic and make sure that they're protecting it as much as they can. And then obviously, like I said, the privacy risk assessment, we suggest you take that just to kind of get a sense of where you're at from a privacy compliance standpoint and anything else you might need to implement to be a little bit more secure and compliant. Jen, any final words?
Nope, keep it up, and thanks for listening.
Great. Thanks, everyone. And we will be sending this out. So if you need to share the recording with anybody else, please feel free. Have a great rest of your day.